I was in a dark place all the time. Even my dreams were about the dark. I coped with my bipolar disorder and my trauma with substance use. But that led to an even darker place, where my mom was planning my funeral. Mental health treatment and recovery activities have helped me to manage my highs and lows. And today, there is light. I'm Michael, I live in Fresno, and I hope that my story inspires you to seek help.
All right, I hope you enjoyed the first of our series of real stories that we're putting on our stigmafreefresno.com website, and they'll also be pushed out on social media and some other media venues. So look forward to hearing more real stories from people you might know. All right, for today, November is Native American Month. I really like this graphic. I'm a fan of quilts, so it reminds me of a quilt. COVID numbers. Oh, we're approaching 50 million now worldwide. We're at 48,280,000 with 1.2 million deaths. And in the United States, 9.5 million with 234,000 deaths. When we get into California, we're up to 940,000 cases and 17,752 deaths. Overall, in the last 7 days, we've had about a 3.54% positive rate in California, and that is slightly creeping up. So we started a few weeks ago at 3, last week it was at 3.3, this week at 3.4. Nowhere near what we're seeing in some other states. I think I mentioned last week that some of the Dakotas are seeing positivity rates of 40 and 50%. And so we're lower than that, significantly lower, but something we're watching closely. All right, by the numbers in Fresno County, we are creeping up in numbers, but we'll talk about it in a minute. We stayed in the red tier, 447 deaths. So we've had about 8 deaths since last week. And in terms of hospitalization, we seem to have found a little bit of a medium spot. So if you look at the upper left graph, you'll see that for the last few weeks, we're just kind of hovering up and down around that 100 mark in terms of hospitalized individuals with COVID. And the number in the ICU has went up a little bit, so that's the middle graph. You can see that number going up a little bit. And the number of ICU beds available is staying right around 20 to 30. So those are the numbers we really want to watch closely. In terms of our trends, you can see here that layered graph we've talked about before, just showing that we're seeing pretty much a stability there in terms of cases and hospitalization. All right, in terms of the tier system, I mentioned it a couple minutes ago. The tiers were announced yesterday. Usually it's on Tuesday, but we had a big event called an election, national election, presidential election on Tuesday, so they delayed it until yesterday. And so we have, we're still at around 5%, 5.1% in our positivity. Came down a little bit in our new COVID cases. And one thing I've heard is that they had been counting the antigen tests in their counts, and that's the rapid test. And the state is only counting PCR tests in this rate, so that probably brought our positivity rate down a little bit. And then our health equity metric, which I'm going to talk about in a minute, is staying in the red as well. So we remained in red. If in any week we go to purple, remember we have to be 2 weeks in purple to go down to the more restrictive tier. Same with getting into a better tier. We haven't been in the orange for a while now. It's been weeks, over a month that we were in the orange on positivity rate. And so if we get back into the orange, we have to stay in the orange in both metrics, including the health equity metric, for 2 weeks in order to move to the less restrictive tier. But the good news now is we've stayed in red. We didn't go to a worse tier. Yay. All right. So what is the health equity metric? Another slide with lots of words. Don't worry, I'll be talking about it. So the health equity metric was added to the tier system to ensure that the test positivity test positive positivity rates in a county's most disadvantaged neighborhoods do not lag behind overall test positivity. So if we went back to the prior slide, which I will do briefly, you can see that you have to have less than 8% positivity to get out of the purple tier. And so they don't want the county to have a really good positivity rate overall, but the health equity metric to, for instance, be over 8. So if the health equity metric was over 8, then we would be in the purple even though our other rates are in the red. So that's something that we have to look at. And each county has to submit a targeted investment plan, it's called, that really defines for the county what are our disproportionately impacted populations and neighborhoods. We have to identify what's the percent of COVID cases in these populations and show how we plan to invest in either increasing testing, increasing disease investigation and contact tracing for these populations, providing isolation and quarantine support. So for instance, if someone lives in a crowded household, providing some dollars for them to maybe stay in a hotel or have a place to stay with food and such. And then education and outreach efforts for workers. Particularly, we do know that some of our frontline workers, essential workers, some of our lower paid essential workers are at higher risk for getting COVID. And so we want to make sure that they understand what are the precautions, what are the signs and symptoms, what to watch for. So in terms of determining what are those neighborhoods, the state uses the California Health Places Index. And that's really a composite measure of an area's socioeconomic opportunity at what's called the census tract level. And there's really 24 individual indicators in this socioeconomic opportunity measure. And they include economic, social, education, transportation, housing, environmental, and other measures. And so each county's census tracts are divided into quartiles for this composite measure. And those quartiles, the lowest quartile, so the lowest 25%, is the health equity quartile. So just as an example, across the state, that lowest 24% account for 40% of the COVID cases. So a disproportionate share of the COVID cases are coming from the lowest socioeconomic census tracts. Now, an interesting thing, and I'm going to show you a map of our census tracts, is that census tracts are different sizes, and we'll talk about that in a minute. So how does the health equity metric affect our tier? So basically, as I mentioned earlier, to stay in a less restrictive tier, the health equity metric has to also be in that tier, plus the two measures we already talked about, positivity rate and case rate. And then you can accelerate your advancement to a less restrictive tier if your health equity metric is lower. So let's say we went for 2 weeks where we stayed in the red on the county-wide case rate and positivity rate, but we had gotten into the orange in our lowest socioeconomic census tracts. We could advocate with the state to move into the orange tier simply based on our health equity metric. And so it doesn't impact movement to a more restrictive tier. It's just you can't get to a less restrictive tier unless you hit those targets. So for Fresno, what are our census tracts? Well, you can see here, it's kind of confusing, but where the red is outlining, those are the lowest socioeconomic census tracts. Some of them are really big. So the way that a census tract is defined is by population, and it's somewhere between 2,500 and 8,000 people. And for us, these represent our lowest quartile, or 25%, represents about 250,000 residents of the county, which is on the left side of your screen. They're pretty big because that's not a very populous area. So it takes a large geographic area to capture that number of people. Versus in the metropolitan area, which is more the center of your screen, that's in the more densely populated urban parts of our county, in Fresno mostly, a little bit in Clovis. where the lowest socioeconomic census tracts are. And so with that, you see a little bit around Selma and Parlier, a little bit around Reedley, and then again, San Joaquin, Mendota, and then parts particularly of the southwest part of Fresno, but also central Fresno. And so a lot of focus is happening. Fresno County put out an RFP for this equity work to be done. And so there's a consortium of entities in our community that were awarded that contract. And so it's funded with CARES Act funding. And there's all kinds of activities going on, including outreach and engagement, testing, and that isolation and quarantine support. So I did want to show you our most recent equity look at our numbers, and you can see that gray line at the very top is Hispanic. And at the beginning of August, it was a really high number of individuals were testing positive. And now we're getting down to, where it's getting closer to the rest of the population. And so we really don't want different ethnicities to be more at risk or represent a higher percentage of our COVID positive. We want everyone to have the same chance to not get COVID. And so all of those activities are around supporting different populations in these different diverse areas to be able to understand how to not get COVID or how to deal with COVID when you have it so you don't give it to other people. So in terms of there's a UCSF-Fresno COVID equity project I wanted to highlight today that's part of this health equity work. And it is around testing. And so UCSF is one of the partners of the equity work. And they have created a clinic that's a standalone clinic, but they also do mobile testing. And what they're doing is they had an ongoing mobile clinic called Fresno Mobile Heal. And they do health screenings and other types of testing and flu vaccinations. And so they took this existing asset or resource, and they're also doing COVID testing. And so basically, you don't have to register. You just drive in, park, and let them know that you're there, and they will come out and test you. What's unique about this site is they give you a rapid antigen test and a PCR test at the same time. So that day, usually, you'll get your results on the antigen test, and then that will be followed by the PCR test to validate that rapid result. Remember that the rapid antigen test, if it gives you a positive, you're most likely positive, but it can have false negatives. So the PCR test will validate if that negative was truly a negative and if your positive was truly a positive. And so that's kind of a unique thing about this location is they're doing both tests. I'm guessing they're probably doing some sort of study as well to see how consistently those two tests align in terms of the results. So this is just an example, and you can see on this slide that actually today the clinic had to close due to high volume, and so each day they stop admitting once they're unable to accommodate the volume. But they do have these mobile test sites, and you'll see that all of those mobile clinics are in areas of the county that are within those lowest quartile socioeconomic census tracts. And so that's the goal of this equity project testing, is to make sure that adequate testing is available to individuals in these lowest socioeconomic census tracts. So I wanted to give you a little more information today about the health equity metric and some of the efforts in Fresno County around that. All right, on to the Creek Fire. We're starting to get fewer and fewer red dots on the Creek Fire map, showing that there's still little activity. They no longer think that Mammoth is at risk in that area. And this weekend, it is supposed to rain and snow. The good news about that is it will likely help to contain the rest of the active areas of the Creek Fire. The bad news about that is that all of those areas that have been compromised due to lack of vegetation for mudslides and debris flow and flooding, they're they're going to be at risk in those areas. So a lot of work has been happening to identify the highest risk areas, areas that could impact someone's residence, areas that could impact the stability of roads, as well as the water in reservoirs and rivers. And so they're really doing a lot of work, cross-collaborative work. I think I talked about this before, called the Winter Readiness Task Force. And so they're just diligently trying to get as much done as possible to be prepared for this rain and snow that's coming. Still focused on ensuring that individuals impacted have access to FEMA benefits. They now have a mobile unit that is available for people to be able to access those benefits, and lots of activities still going on. All right. Most of you, if you're not new, know that every spring during Mental Health Month in May, we have a picnic, and all of our staff is rewarded with a lunch where we get to recognize our staff for all of the hard work they do. And unfortunately, because of the pandemic, we just weren't able to do that this year. So over the last few months, we've kind of struggled with what could we do in lieu of that lunch that we all got to share. And so as a show of our thanks, we're going to be providing you with a holiday pie, a sweet tribute. And so today you'll be getting a little survey monkey to tell us if you prefer an apple or a pumpkin pie, and if you have any dietary restrictions, and a little bit of input on exactly when you would get the pie. We're trying to figure out if the Friday before Thanksgiving or the Monday before Thanksgiving is a date that would be better for people to pick up pies. And so please fill out the survey. If you don't fill out the survey, you'll probably get a pumpkin pie. That's what we've decided. So please let us know what your preference is, and take this pie as a reward for all of your hard work. We know that the last several months have been a strain on all of us, a strain on our family lives and personal lives, as well as our work life. And for some of you, that balance between your family and work as you're working from home has definitely been difficult at times, if not all the time. And so this is a small token of our appreciation for the work you do day in and day out to meet the needs of the people we serve. And for that, we are very, very grateful. All right, wear your mask, physical distance, and let's see if we have any questions. Okay. Oh, yes. A reminder that we have pumpkin decorating, costume and yard and office decor contests going on. I think that it went through maybe today or maybe Friday. And so please, if you participated in that, make sure you get your entry in. And if not, please vote for the winning costume decor. All right, any other questions? Let's see. Do you have anything, Brian? Yes, we have one. One came through text.
Will the RISE conservatorship team be moving to the old AT&T building?
The question is, will the RISE conservatorship team move to the old AT&T building? If you'll recall, last week we talked about the purchase of the building, or maybe it was a week before, I can't really remember. And so what I would tell you is as that purchase gets finalized, because we did get board approval, but there's an escrow period and that purchase isn't finalized yet. Once it's finalized, we'll start the process of space planning. And as part of that space planning, we'll be identifying specifically which services, which teams will relocate to that building and under what timeline. We do still anticipate the UMC campus getting through its escrow. And so that will help drive what moves, when it moves, based on how quickly we need to get off that campus. A couple of years ago, when this first started, we were given timelines, a phased approach to vacating that campus, and all of that kind of went up in the air with a delay in closing that cell and also COVID. So we'll have to kind of revisit that phased moving out of UMC. And once we do that, we'll get a better idea of the timeline and which teams will move. So what I can assuredly tell you is nothing's in stone right now. And so as we move forward, we'll be working diligently to figure out the best place for all of our teams and accommodate those needs. A reminder that we also are looking at some changes to the Heritage Campus, and so that will be available as well, and that will be part of our thought process. Right now, we're hoping to relocate our Crisis Stabilization Center and our inpatient units there, and so that will be the main priority on that campus, but there may be other services that we decide to put there as well. So stay tuned, be patient, it'll take a little bit of time, but we will be working with you and communicating as we move forward and have more information.
I'm not sure if this is a question or a comment. The county sites are having people swab themselves. I have heard that many people are not doing it correctly. Do we know if this is accurate?
Okay, so some of the testing sites allow the person being tested to swab themselves. And so I'll talk about this a little bit because I have been tested before. I didn't get to swab myself. They stuck it way high up in your nose. And so it's my understanding that for some of the tests, you are allowed to test yourself. It is less important that you get the swab way up in your nose as it is with the other test. And so the concern that was raised is whether or not that's accurate, or whether people are doing it accurate, or whether that test result will be accurate. Obviously, since I'm not there, I can't tell you with assurance that every single test that's conducted by the person is done appropriately. But I do know that when you are being tested, there should be someone there who's watching you and observing how you're administering the test to yourself and ensuring that you're doing it properly. If you were tested and you have concerns about the how well someone was monitoring you or whether or not you did it accurately, I would certainly address that with the staff at those sites. You're also welcome to contact public health and express your concerns about that specific site. If you feel uncomfortable or have a concern, I'm sure they'd be happy to hear what you have to say. All right, another one. The test at Fresno City does the nostril test, not the deep one anymore. Yeah, the equity project, I believe also you administer the test yourself. And so in some ways, I think it might be easier. It's certainly easier to get the test. Harder to know, when you had the previous test, you knew when it got far enough. Quite obvious. You felt like it was in your brain. With this one, maybe because you don't feel that, especially if you've had the prior test, you might feel like they're not doing it well enough. But that is becoming a more common test because it is more comfortable and the test kits and such have become readily available. Any other questions? All right. With that, we will finish the update for today and we will talk to you next week. Please answer your survey and also vote on the Halloween contest. Thanks.